A new way to find out your risk for a variety of cancers and other potentially life-threatening diseases is coming to Nebraska Medicine.
It's part of a research project in partnership with Helix, a population genomics company.
KETV News Watch 7's Maddie Augustine has more details on this new form of healthcare.
Known as population genomics, Nebraska Medicine tells me their new program will change the idea of standard care.
In a new partnership,
we truly believe this is going to save the lives of Nebraskans.
Nebraska Medicine and Helix, a California-based leading population genomic and viral surveillance company, hope to provide precision care through the Genetic Insights Project.
What we're looking to do is, instead of kind of a one-on-one getting people's genetic information, we'll be looking at actually doing this across a very large group, or essentially a population across Nebraska.
The project will use genomics.
Genomics is a new tool to find people who have underlying conditions and underlying risk, and helping to manage that type of risk.
Nebraska Medicine says participants simply provide a blood or saliva sample for testing at Helix's lab for CDC Tier 1 conditions.
Initial screen will look at three main conditions: one related to breast and ovarian cancer risk, one related to colon cancer risk, and one related to cardiovascular risk.
Conditions that often go undetected until later stages.
A lot of these conditions are things that we know of already, but are oftentimes underdiagnosed or aren't diagnosed until much, much later in a course of disease.
90% of the participants who have findings have historically been missed in clinical practice.
Ultimately, Nebraska Medicine says this program will be able to identify patients who need earlier intervention, helping to prevent cancer and cardiac disease, and identify health trends in the region.
The Genetic Insight program is set to launch in the new year and hopes to enroll 100,000 people. Anyone age 19 or older will be allowed to sign up for this program free of cost. Maddie Augustine, KETV News Watch 7.